Hello everybody and welcome back to our teaching channel. I'm Dr. Sadiq and today we'll be discussing what is atrial fibrillation. Atrial fibrillation is an abnormal rhythm of the heart that will lead to abnormal contraction of the heart. Before we understand what atrial fibrillation is, let's discuss what a normal heart rhythm is. During normal sinus rhythm or normal electrical activity of the heart contracts in a reproducible, regular fashion. To explain the cardiac cycle, I'm going to show you a picture of the heart over here. The heart is made up of 4 chambers: the right atrium, the left atrium, the right ventricle, and the left ventricle. As you can see, the electrical activity first begins in the top 2 chambers, the right and left atrium. This causes the top chambers to contract, leading to blood being pushed into the bottom chambers, the left and right ventricles, which then contract, pushing the blood out to the lungs and to the body. This cycle happens in a regular manner, normally 60 to 100 times per minute when you're resting, and leads to what we effectively feel as a regular heart rate. The heart rate can increase with activity, such as running, or go down with inactivity, such as sleeping. But it's usually regular and quite predictable. In patients with atrial fibrillation, the electrical activation of the top chambers, the atriums, becomes highly erratic and non-predictable. This leads to abnormal firing of the atrium, so that instead of beating in regular fashion, they start jiggling or fibrillating. This leads to 3 separate problems. Number 1, the atriums are fibrillating now, so they no longer effectively empty the blood inside them into the ventricles. Number 2, the heart rate becomes irregular. And number 3, the heart rate can become rapid as electrical signals travel from the atrium down to the ventricles in a rapid and irregular manner. All of the above can cause the symptoms of atrial fibrillation that patients may feel. These symptoms can range in severity from nothing at all. So some patients will not feel the atrial fibrillation and it will not affect them. And it could be an incidental finding when you see your doctor. It can also cause very severe symptoms such as stroke, which is very disabling and life-changing. The vast majority of patients are somewhere in the middle, where they may not get a stroke, but they do have some symptoms such as fatigue, palpitations, shortness of breath, and reduced exercise tolerance. In cases where the heart is very rapid for a prolonged period of times, this can lead to weakening of the heart and what we call heart failure. Now that you know what atrial fibrillation is, what do we look at when we treat it? Well, there's 3 big issues that we need to treat and address when we have a patient with atrial fibrillation. Number 1, prevent stroke. The reason patients can develop a stroke when they have atrial fibrillation is because the atria are now fibrillating rather than contracting effectively. And when they fibrillate, the blood stagnates inside the atrium instead of moving smoothly from the atrium to the ventricle. This stagnation of blood causes blood clots to develop in the atria, and these blood clots can then embolize or escape from the atrium and go to the circulation, such as the brain or other organs, leading to stroke if they go to the brain, or other problems if they go to the rest of the body. The main way to prevent a stroke is to start on a blood thinner. Not everybody requires a blood thinner, and we'll discuss that more in oncoming videos. The second thing we need to treat is the symptoms. Like I said, some patients feel nothing when they have atrial fibrillation, and in those patients, we don't necessarily need to treat the symptoms. However, there are some people who are quite disabled by the atrial fibrillation because of fatigue, shortness of breath, palpitations, or general feeling of unwellness. In these patients, we may consider either using medications to reduce their heart rate or getting them back into normal rhythm. Finally, and one of the most important things we need to do in patients in atrial fibrillation is figure out the causes and treat them. What can cause atrial fibrillation? We'll discuss that in a future video. If you like this video, please subscribe to my channel and you'll be updated on future videos to come. Thank you very much.